And now I'm going to show you the procedure for the above the knee limb loss ACE wrapping. You certainly would utilize 2 larger 6-inch ACE wraps as well as 1 4-inch ACE wrap. And then, as mentioned before, you would throw these out, okay, and utilize the tape instead. I'd like to show you the finished product first before we go through the steps with the ACE wrapping. What I'd like for you to notice is the anchoring above the hip joint, the use of a figure of 8 type of a wrap. Initially, the 2 6-inch wraps helped to give some good firm support to help provide pressure towards that area that tends to have an adductor roll. And then secondly, the smaller ACE wrap was used to try to grab hold of the distal portion of the limb and give pressure upward, so a little bit more pressure upward from distal to proximal.
And wrinkles.
And you want to make sure that all the wrinkles are out. Very good. Now for the procedure of the ACE wrapping for the above the knee limb, you want to, as I mentioned before, use the 2 6-inch ACE wraps. For those ACE wraps, you're going to be using a direction where you're going to start medial in the groin region and go lateral. Both those wraps will be in that position, and then we'll do the opposite for the smaller 4-inch wrap. So we're going to be coming around. One thing I do want you to take note when you're working on a simulated client, it's a little bit more difficult because the material is very firm in comparison to a real person. So if you're able to do it in this fashion, it'll be easier with your clients. Then you're coming around back to do the anchoring. All the way. Keep coming until you come to the back of the leg again, and again you're going to come around and capture. We'll pull that up a little bit more. Looks like it's loosening up a little bit. Capture a little bit more. And go ahead and put the tape on in place. I'm going to come back and make sure I get these wrinkles out. What happens is when they're older ACE wraps, some of the older ACE wraps tend to wrinkle a little bit more than the newer ones. Okay, that should be good. All right, so we have the second one. Again, coming in the groin region, okay, coming laterally, coming up way high if you can, which typically is a lot easier with the individual because they're not going to have this hard feel to it. Okay, coming back around again for the anchor. And one more time, coming all the way around, capturing medially. Now you're going to be ending right there in the front. taping it in place. Again, this is an older wrap, so I want to make sure we've worked out all those little bugs, if you will. Okay, now the important concept for the two larger rolls is to make sure that you are getting some good coverage over the adductor region. Next, we're going to grab hold of the 4-inch ace wrap. As before, we had gone medial to lateral. With these wraps, we're going to do the opposite. We're going to go lateral to medial. You don't have to worry about doing anchoring with this because you have already done that with the larger rolls. And so the main reason for the smaller wrap is to get good coverage distally. And if need be, you can even use another wrap if you need to do that. Since there's not much left with this particular wrap, I will go ahead and just bring it up here so it's in an accessible place to secure. So you want to make sure that it has nice, good, firm pressure here with wrapping up towards that direction.